Good evening, guys. I have discussion C for you. We're discussing mental health care is transforming with personalized therapies and holistic well-being practices. So we're going to discuss that for C. So please join me for the presentation I made for you. Sit back and enjoy, folks. Okay, mental health paradigm shift. Dr. Stephen C. Hayes, founder of Acceptance and Commitment Therapy Act, argues that traditional mental health models are outdated. The emerging model emphasizes personalized science processes of change and human thriving over diagnostic categories. Okay. Diet and mental health connection. A study published in Nature Medicine shows that switching from a traditional African diet to a Western style diet for let me get just 14 days can increase inflammation and impair immune function. Conversely, the heritage African diet, rich in vegetables, fiber, and fermented foods, boosts metabolic health and reduces inflammation. Cross-cultural research. The study involved 77 healthy transients, men from urban and rural areas. Participants either changed diets or consumed a fermented banana beverage. Daily blood and immune markers were tracked over time. Function over labels. Dr. Hayes emphasizes that mental health should be assessed by moment to moment functioning, not rigid diagnostic categories. The piece beautifully aligns with your interest in culturally responsive care and myth busting. If you'd like, we could sketch out a participatory framework that integrates dietary interventions into mental health toolkits, especially for communities navigating food insecurity or cultural transitions. The personalized science approach championed by Dr. Stephen C. Hayes and others is a transformative shift in mental health care that moves away from rigid diagnostic categories toward individualized, functional understanding of well-being. Here's a deeper dive. What personalized science in mental health function over diagnosis. Instead of labeling someone with a disorder, e.g., depression, anxiety. This approach asks it how is this person functioning moment to moment, and it focuses on patterns of behavior, emotion, and cognition that interfere with thriving rather than fitting symptoms into predefined boxes. Process based therapy, PBT, personalized science rooted in PBT, which targets core psychological processes like avoidance, cognitive fusion, or lack of values based on action. These processes are measurable, modifiable, and transdiagnostic, meaning they apply across many conditions. Contextual and cultural sensitivity. It recognizes that mental health is shaped by environmental, cultural, and social contexts. For example, what counts as healthy coping in one culture may be viewed differently in another. So interventions must be tailored accordingly. Real-time adaptation. Therapies are adjusted based on ongoing feedback from the individual's experience, not just standardized protocols. This allows for dynamic, responsive care that evolves with the person's needs. Why it matters for equity and community-based care. This model aligns beautifully with your work in participatory design and culturally adaptive frameworks. It honors individual and community wisdom over top-down clinical authority, supports co-design interventions that reflect lived experience, enables myth busting by challenging one size fits all assumptions in mental health. Would you like to sketch out how this could be integrated into a caregiver toolkit or rural aging initiative? We could phototype a process-based assessment tool that's culturally responsive and easy to adapt across communities. While the personalized science approach offers a compelling shift toward equity and adaptability, it's not without its implementation hurdles, especially when scaled across diverse systems and communities. Here's a breakdown of key challenges: structural and systematic barriers, insurance and reimbursement models. Most healthcare systems still rely on diagnostic codes or for billing processes. Based individualized care doesn't fit reality into these frameworks, making it harder to fund or sustain. Training and workforce readiness. Clinicians are often trained in manualized diagnosis driven models. Shifting to process-based therapy requires retraining, ongoing supervision, and a mindset shift toward contextual, functional, and assessment. Data infrastructure gaps. Personalized science depends on real-time feedback and behavioral tracking. Many community clinics lack the tech infrastructure to support this, especially in rural, underserved, resourced settings. Hold on, folks. Cultural and community considerations. Risk at over personalization without cultural anchoring. If not grounded in community wisdom, personalization can become hyper individualized and miss systematic or cultural detriments of health. Equity and access. Tailored interventions. Marginalized populations may face barriers to accessing adaptive tools, whether due to digital divides, language, or mistrust of systems. Scaling participatory design. Co-creating interventions with communities is powerful but time intensive. Scaling this ethically across religious and populations requires thoughtful infrastructure and facilitation. Clinical complexity. Measuring psychological processes. While promising some processes like experimental avoidance of values, alignment are hard to quantify. Reliability across cultures and contexts. Navigating comorbidity and complexity. Personalized approaches must account for overlapping conditions, trauma histories, and social detriments without losing clarity or coherence. Would you like to co-map these challenges into a framework for implementation in community-based aging or cognitive health programs. We could sketch out a readiness checklist or participatory rollout guide tailored to your work. These are several compelling examples where personalized science has been successfully implemented, especially in mental health, chronic disease management, and culturally adaptive care. Here are a few that might resonate with your work. Okay, acceptance and commitment therapy in community mental health. What worked? ACT focuses on psychological flexibility and value-based action rather than system reduction. It's been adapted for diverse populations, including indigenous communities and refugee groups. Why it's personalized. Therapists tailor interventions to individuals' cultural values, language, and lived experiences using process-based assessments. Impact. Improved outcomes in depression, anxiety, and trauma-related conditions, especially where traditional diagnostic models fall short. Diet-based mental health interventions in Tanzania. Study highlighted a cross-culture study showed that switching from heritage action diet to a Western style diet for 14 days increased inflammation and impaired immune function. Personalized element. Participants' diets were adapted based on their urban cultural context and cultural food practices. Implication. Mental physical intervention must be tailored to dietary heritage and microbiome diversity, especially in aging populations. Precision psychiatry using digital pentatyping. Example, researchers used smartphone data, sleep, movement, social interaction to track psychological processes in real time. Why personalized instead of relying on static diagnosis? Care is adapted based on dynamic behavior patterns, use cases, suicide prevention programs that intervene based on changes in digital behavior, especially effective in youth and marginalized groups. Process-based cognitive health toolkit for aging adults. Community co-design toolkit built with older adults in rural areas, focus on values, cognitive engagement, and social connection. Personalized science in action. Assessments measure functional changes, e.g., memory, attention, and adaptive activities accordingly. Result: increased engagement, reduce isolation, and better alignment with cultural norms around aging and autonomy. Would you like to co-develop a participatory framework that blends these approaches into scalable models for rural aging or caregiver support? We could sketch out a modular toolkit that integrates diet, digital pentotyping, and ACT principles tailored for community-led adaptation. Personalized science draws on a rich mix of methodologies that personalize individual functioning, context, and diagnostic adaptation over static diagnostic categories. Here's a breakdown of the most effective and engaging approaches, many of which align beautifully with your participatory, equity-driven work. Process-based therapy. Core idea: target transdiagnostic psychological processes. Avoidance, cognitive fusion rather than disorder. Methodology: functional analysis, behavior, moment-to-moment tracking of psychological flexibility, use of value-based interventions. Okay, guys, so that is it for tonight. I will see everybody Monday for shows, like I said earlier. For now, Gator Wellness, take care, folks.